Hello, welcome to my channel. The title of my video today is Schizophrenia. We are on part 3. Please hit the thumbs up, please subscribe, and please share this video. My first question taken from RN Nclex examinations. Client diagnosed with paranoid schizophrenia. Client at risk for violence towards others, disturbed sensory perception. If prior suicide attempt, what would be your nursing diagnosis? And the correct answer is risk for suicide. My next question, client admitted. Diagnosis, nursing diagnosis is impaired home maintenance related to regression behavior. What confirms a nursing diagnosis of impaired home maintenance? The correct answer, client lives in unsafe, unclean environment would confirm on nursing diagnosis of impaired home maintenance. My next question, we're talking about planning and interventions for our schizophrenia clients. Our nursing diagnosis is social isolation. What will be our planning and intervention for social isolation? And the correct answer, client will participate actively in unit activities by discharge. Client will participate actively in unit activities by discharge. The next question, what would be your outcome for clients with schizophrenia? Your outcome for clients with schizophrenia, correct answer is client will recognize distortions of reality by discharge is a realistic outcome. Client's hearing, seeing things others do not see. Client experience hallucinations. Clients having altered perceptions. All these are outcome for the clients will be client will recognize distortions of reality by discharge is a realistic outcomes for hallucinations, altered perception. The next question is, what kind of disease is schizophrenia? The correct answer, it is a chronic, incurable disease. My next question is, client is admitted, non-compliance with anti-psychotic medications. What would be your nursing planning and intervention for non-compliance? The correct answer, client will take anti-psychotic medications by discharge is your correct answer for non-compliance with medications. My next question, client admitted taking Zyprexa. The name for Zyprexa is also olanzapine at home. So client is admitted, he's taking Zyprexa at home. Patient is diagnosed with bipolar schizophrenia. Nursing diagnosis is altered sensory perception. Rule out command hallucinations. auditory hallucinations that command or instruct client to act in serious ways that are life-threatening. What will be your nurse's outcome for this patient? What will be your outcome for your patients experiencing hallucinations? The correct answer is client will notify nurse about bothersome hallucinations. When client reports hallucination, client is better in touch with reality and moving towards remission. So clients with altered sensory perceptions, hallucination that are bothersome, or outcome for this patient is the client will report this. When client reports hallucinations, client is better in touch with reality and moving towards remission. Encourage communications and trust. So your client empathize. So your client feels free to come and talk to you about any hallucinations. You want client to come and communicate to you. Be open to a therapeutic communication, a trusting relationship, that when client is hearing, seeing things that others do not see, they can come to you and talk to you, and you'll help them to face reality that things are not what it appears to do, moving client towards remission. The next question is, homeless client admitted complaining of insects infesting arms and legs. What should the nursing implementation be? And the correct answer is, check client's body for lice before. Rule out physical cause before determine psychological cause. So your client is communicating that insect is crawling all over his body. Usually these people are unkept, their hygiene is poor, maybe they live in the streets and they feel insects crawling all over them. What the nurse has to do when the patient is admitted, do a head-to-toe assessment for lice or insects on your patient's body to determine a physiological cause. If it's not physiological, if you didn't see any lice or ticks or bed bugs, a lot of them coming with bed bugs, then you can determine psychological cause. My next question is implementation, altered thoughts, perception. What will be your implementation for altered thoughts, perception? And the correct answer is encourage trust is priority. You need patients to come and talk to you when they're having hallucinations. You'll help them to figure out sense versus nonsense. Promote further client communication. Assist client to accept perceptions are unreal, emphasizing with client. Help them towards remission. My next question is, client with disturbed thought processes, what will be the expected outcomes for clients with disturbed thought process? Correct answer, client will recognize delusional thinking by coming to the nurse, talking to the nurse, she will assist them to recognize delusional thoughts. She can direct them towards remission, communication, assist client to accept perceptions are unreal, and emphasize with client. My next question. When clients have impaired thoughts, disturbed thoughts, what should the nurse do? And the correct answer: appreciate client, notify nurse of disturbed thinking. When the nurse conveys understanding that the client is experiencing delusional thinking, the nurse is showing empathy for client's situation and building trust is the correct answer for patients with disturbed thinking. The next question, this patient has paranoid schizophrenia, and the question is, what would be the intervention for client in active phase of paranoid schizophrenia? And the correct answer is, first, you establish a trusting relationship. Next, you assign consistent staff members. Next, one-on-one sitter need a doctor's order for sitters. These paranoid patients, someone is following them, someone is trying to poison them, they see things that are not there. They need one-on-one sitter for hallucinations. They are at risk for self-harm. They are hearing things. Someone telling them maybe kill yourself. They need one-on-one sitter. The next question, new admission, scanning the environment continuously. This patient is admitted an unfamiliar environment. Scanning the environment continuously. What will the nurse do is the question. The correct answer is the nurse will offer self. Build a therapeutic, trusting relationship. Client exhibiting paranoia. Client have trouble trusting others. Please hit the thumbs up. Please subscribe. Please share this video. Stay blessed. Stay tuned for part 4 for schizophrenia. Thank you. Have a good day.